I want to talk more about what's happening in our schools, and I want to bring in our guest now, Donna Hallas. She is a director of the Pediatric Nurse Practitioner Program at NYU, and Dr. Saju Matthew is a public health specialist and a primary care physician. Welcome, both of you. So, Donna, let me begin by asking you, there are likely thousands of nurses in the same position that Deneen is in right now. They love their job, but they also love their family, and they want to stay healthy. What measures need to be put in place to address those concerns?
So, one of the big measures is testing in children and the families prior to coming to school. That's critical. We don't have data right now on the children who will be going to school, and to make any types of decision, testing is critical. Also, I heard her mention masks. Masks are the new norm. Young children can wear masks over the age of 2. The parents can, be role models, the teachers, everybody. That's critical. And for children, like protecting their eyes as well, because children will tend to rub their eyes, especially children with like any types of allergies, anything like that. So those things are critical. And I'm really thrilled that Mayor de Blasio for New York City has said there will be a school nurse at every school. That's a critical role.
It is a critical role, especially when you see in the stat in that piece that there's one nurse for every 500 students. So many schools only have part-time nurses. Dr. Matthew, I want to ask you how you envision this working. I mean, most kids go to school with runny noses and mild colds. I know in my kid's case, in most schools, if you don't have a fever, if you're not vomiting, you can come to school. Well, what happens when a kid starts to display some of these symptoms in the classroom?
Bianna, I have the same question regarding, what I'm going to do as a primary care physician, as the flu season approaches, because Donna's task, as she mentioned, of trying to distinguish flu-like symptoms or a cold from COVID-19 is going to be really difficult. And then let's talk about testing. I know we talk about it all the time, but if a kid falls sick, will they have these point of care testing so that you can make sure that that kid is negative and won't take the virus back home? So I think this is going to be a daunting task. I think that the ratio of nurses to students, we need to look at that as well. And we need to make sure that our nurses are protected with the appropriate PPE, masks, and the kids as well.
And let's add another layer of complexity, doctor. We also know that children can be asymptomatic. And while the administration may be pointing to data suggesting that those under 24 may be less impacted, many adults are at these schools and they're well over the age of 24. What happens when one of them becomes sick? I mean, can contact tracing be done effectively, especially if you don't have results for days on end?
So, Bianna, you hit all the points right on the nail. I've talked about this so much, which is, number one, we should really even back up. If the community transmission is greater than 5%, and you have that much virus, if you will, in the air, we really shouldn't even be talking about schools opening. I've always said it's easy to open a school, but can you keep that school open? It's just a matter of time when a teacher, a nurse, or a student falls sick. And these are how clusters develop into surges. So I want us to even back up one step and say, listen, what does your community look like? What does the transmission look like? And look, Bianna, we have enough data to show that kids act just like adults as vectors, and they take it around them. Kids do not live in a bubble.
Donna, I spent quite a bit of time talking with Deneen for that piece, and one thing that she told me that didn't make the piece that I thought was interesting was the importance that parents play in bringing your kids to school and making sure that it's a safe environment and that this goes as well as possible. She talked about parents having to be honest and forthcoming about whether or not their children or somebody at home is not feeling well, to make sure their children are careful and to constantly wear their masks. And I have to tell you, I always am nervous when I get a phone call, right, from the school nurse. You never know what happened, but I feel that relationship is ever so much more important now that we're dealing with a pandemic and sending our children to school. Do you agree with that? How important is that direct relationship between the nurses, the administrators, and parents?
Yeah, nurses are well respected, well trusted, and make great relationships with parents, with children, with the school personnel. And I totally agree. We have to have that relationship. And there needs to be like an app on the phone before the kids could come to school, in which they would be able, the parents would be able to document their temperature, to document a list of symptoms. Do they have a cough? Do they have a runny nose? Do they have diarrhea? All those types of symptoms that children may display, because children do display symptoms a little differently than adults. And if it's a no, 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 then they can come to school. If it's yes, then they have to, there's a stop and they can't go that day. So we have to trust that the information the parents are putting in, and they're going to do it routinely. So that's another thing, that's preparedness for going to school. And I think this is a good time to also point out, because we're going in, September, October, and November begins flu season. Various parts of the country begin at little different times. The flu vaccine should be mandated, in my opinion, for attendance to school, because we be able to tell the difference between flu and COVID symptoms. We need that assurance for the kids.
Yeah, and we've heard from the CDC director himself that this is a recipe for disaster when you've got the confluence of both the flu season in the middle of a pandemic. This is something that both administrators and parents need to be taking seriously and addressing, so that we can send our kids to school if at all possible. And you're right, getting as many nurses to school as possible as well, and respecting them and making sure that everyone is taken care of. Thank you so much. I really appreciate it. It's a great conversation. Well, one way to stop the spread of coronavirus is